Heart health becomes a critical focus for seniors in the United States, Canada, the United Kingdom, and Australia. As cardiovascular diseases remain the #1 cause of death, particularly in the United States where nearly 700,000 deaths each year are attributed to heart-related issues. According to the CDC, every senior deserves to know exactly which vitamins could truly make a life-saving difference, because losing the ability to live actively, losing breath just walking across the room, or depending on countless medications is not a future anyone dreams of. Supplements are not just trendy capsules sitting on pharmacy shelves. For many seniors, they are a desperate tool to hold on to vitality, to hold on to their independence, to enjoy another day with grandchildren, to wake up and feel their heart beating strong without fear of the next doctor's call. Vitamin D3 is absolutely crucial. Yet tragically, an overwhelming number of seniors in the United States are deficient without even realizing it. And this deficiency directly raises the risk of hypertension, heart attacks, and sudden cardiac death. Studies show that low vitamin D levels can stiffen arteries, increase inflammation, and worsen high blood pressure, which are silent killers that don't announce themselves until something catastrophic happens. Seniors living in colder regions of Canada and the United Kingdom are particularly vulnerable, spending long months without enough natural sunlight to manufacture sufficient vitamin D. Without this vitamin, the heart struggles more than people realize, because vitamin D receptors are present in the heart muscle itself, meaning the heart quite literally needs it to function properly. Daily supplementation with vitamin D3, ideally combined with vitamin K2 to guide calcium into the bones and out of arteries, can make a measurable difference in cardiovascular outcomes. It is shocking how many Americans are rushed to emergency rooms without anyone checking their vitamin D levels first, and it is painful to realize that one simple supplement might have made all the difference. Magnesium deserves urgent attention too, because magnesium deficiency is called the invisible deficiency for a reason. It can exist for years without obvious symptoms, quietly damaging the cardiovascular system behind the scenes. In the United States, about 75% of the population does not meet the recommended intake of magnesium, and seniors are especially at risk because absorption naturally declines with age. Magnesium is vital for regulating blood pressure, stabilizing heart rhythms, and preventing spasms in heart arteries, yet many seniors only find out about their deficiency after a terrifying experience like atrial fibrillation or a full-blown heart attack. In Canada and Australia, studies have shown that low magnesium intake correlates directly with increased mortality from ischemic heart disease. Heart cells literally need magnesium to maintain electrical stability. When the body runs low, the heart can beat irregularly, sometimes fatally. Seniors should prioritize highly absorbable forms like magnesium glycinate or magnesium citrate, rather than relying on cheap magnesium oxide pills that barely get absorbed at all. A tragic waste of time when the heart is desperate for help. Coenzyme Q10, CoQ10, is another powerhouse nutrient that becomes non-negotiable after age 60, particularly for those in the United States, where the use of statin drugs is rampant among seniors to control cholesterol levels. What doctors often fail to warn patients about is that statins drastically reduce the body's natural CoQ10 levels, starving the heart of a critical molecule needed for energy production inside mitochondria. Without CoQ10, the heart weakens, fatigues, and struggles to pump efficiently, leading to a cascade of problems, including heart failure. In places like the United Kingdom and Canada, where statin prescriptions are also widespread, seniors may be experiencing muscle weakness, fatigue, and shortness of breath, blaming old age when it might simply be a deficiency that could be corrected. Research out of Australia confirms that supplementing with CoQ10 can improve heart function, exercise capacity, and even survival rates in patients with heart disease. Seniors should look for ubiquinol, the active form of CoQ10, as it is significantly more bioavailable, particularly important for aging digestive systems that struggle with nutrient absorption. Omega-3 fatty acids, primarily EPA and DHA from high-quality fish oil, have been extensively validated in countless studies to protect the heart, lower triglycerides, reduce blood pressure, and prevent sudden cardiac death. Yet many seniors in the United States and other countries are walking around deficient, eating processed foods high in omega-6 fats that promote inflammation instead. A senior living in Texas or Florida may think they are eating healthy simply by avoiding fast food, but without sufficient omega-3 intake, their arteries may still be silently inflamed, slowly building up the plaques that could eventually cause a fatal heart attack. Canadian heart health guidelines now emphasize the critical role of omega-3s in maintaining cardiovascular integrity. And yet surveys show that actual intake among Canadian seniors is far below recommended levels. Choosing a purified pharmaceutical-grade fish oil supplement, ideally with a balance of both EPA and DHA, can be a literal lifesaver, particularly in seniors with a history of cardiovascular events. Many stories from heart patients across the United Kingdom and Australia describe remarkable recoveries and improvements in energy after committing to high-quality omega-3 supplementation. But the key is consistency and correct dosing, not the occasional capsule here and there. Vitamin K2, particularly in the MK7 form, has emerged as a hidden hero for heart health, especially among seniors. Most Americans associate vitamin K only with blood clotting, but K2 has a very different, critically important role. It activates proteins that direct calcium to where it belongs, in bones and teeth, and away from the arteries. Without enough K2, calcium starts building up inside arteries, a deadly process called vascular calcification that massively increases the risk of heart attacks and strokes. Seniors in the United States consuming a typical Western diet are particularly vulnerable because vitamin K2 is scarce in modern processed foods and even in many natural diets, unless fermented foods are regularly eaten, which is rare today. A study in the Netherlands showed that higher vitamin K2 intake was associated with a 50% reduction in the risk of dying from heart disease. Imagine how many grandmothers and grandfathers in the United States, Canada, Australia, and the United Kingdom could live longer, healthier lives if only they were told about the critical importance of vitamin K2 early enough. It is heartbreaking to think how many deaths could have been prevented. Vitamin C, often seen as just an immune booster, plays a deeper, more profound role in heart health, especially for seniors. It is vital for the production of collagen, the main structural protein in blood vessels, meaning it literally helps maintain the strength and elasticity of arteries. Without enough vitamin C, arteries become brittle, prone to tearing, and vulnerable to the formation of plaques and blockages. In the United States, where poor dietary habits are rampant and fresh, produce intake is often insufficient, many seniors are unknowingly operating at a suboptimal vitamin C level, even if they aren't showing obvious signs of scurvy. Researchers in Canada and the United Kingdom have documented clear links between low vitamin C levels and higher rates of coronary artery disease. Australian studies have gone further to show that supplementation can help reduce arterial stiffness, a major predictor of heart attacks. A high-quality vitamin C supplement, preferably in a buffered or liposomal form for better absorption, can be an inexpensive yet incredibly powerful tool to strengthen cardiovascular resilience, especially during the fragile senior years when every heartbeat matters immensely. Vitamin E, particularly in the form of tocotrienols, rather than the commonly used alpha-tocopherol, offers seniors a deeply underrated shield against heart disease. Most vitamin E supplements sold in the United States are loaded with only alpha-tocopherol, and the tragic reality is that over-supplementing with alpha-tocopherol alone can actually block the absorption of the critical tocotrienol forms, which have been shown to dramatically reduce oxidative stress and inflammation inside blood vessels. In Canada, clinical trials have confirmed that tocotrienols can reduce arterial plaque, lower LDL cholesterol oxidation, and protect the heart against ischemic injury. Seniors struggling with cardiovascular issues in Australia and the United Kingdom are starting to hear about tocotrienols through more progressive cardiologists, but awareness remains alarmingly low in the United States, where aggressive pharmaceutical marketing often drowns out natural, safer alternatives. It is heartbreaking to think about how many seniors, taking handfuls of pills each day for their heart, could have had better outcomes if only they were given access to the right form of vitamin E earlier, before damage had already progressed. Vitamins, especially B6, B12, and folate, are absolutely critical because they regulate homocysteine levels, an often overlooked but incredibly potent risk factor for cardiovascular disease. High homocysteine levels make blood vessels brittle, increase clot formation, and sharply raise the risk of heart attacks and strokes. Yet most seniors in the United States have never even heard of it. Homocysteine testing is not routine, and so countless elderly patients are walking around with a ticking time bomb inside them, completely unaware. In the United Kingdom, clinical guidelines now recognize the role of B vitamins in heart protection, particularly for stroke prevention. But supplementation rates remain frustratingly low. Seniors should be choosing methylated forms of these vitamins, such as methylcobalamin and methylfolate, because absorption and utilization decline with age, and synthetic forms like cyanocobalamin simply do not get the job done well. In Canada and Australia, where some foods are fortified with folic acid, rates of neural tube defects dropped dramatically, proving how vital these nutrients are. Yet heart health protocols still lag behind in emphasizing their daily use for seniors. Potassium is a mineral that deserves far more attention in the discussion of heart health, especially among seniors facing high blood pressure and arrhythmias. Potassium works to balance sodium levels inside the body, and low potassium intake can lead to uncontrolled hypertension, muscle weakness, and deadly heart rhythms. Despite its importance, surveys show that 98% of Americans do not get enough potassium daily, a shocking statistic that should be ringing alarm bells in every cardiology office across the United States. In Canada and Australia, public health campaigns have focused more on reducing salt intake, but increasing potassium intake is equally important and yet remains underemphasized. Seniors can dramatically reduce their cardiovascular risk by increasing their intake of potassium-rich foods like avocados, spinach, and sweet potatoes. But supplementation may still be necessary for many, especially if medications like diuretics are causing further depletion. Potassium supplements must be used cautiously and under medical supervision, especially for those with kidney issues. But when managed correctly, they can be life-changing for blood pressure control and overall heart function. Selenium is another nutrient that rarely gets the attention it deserves, yet plays an irreplaceable role in heart health through its antioxidant properties and involvement in thyroid function, which indirectly affects heart rate and cardiovascular resilience. Research from the United Kingdom and Australia has consistently shown that low selenium levels are associated with higher rates of heart disease and heart failure. And in regions of the United States with selenium-deficient soils, such as parts of the Midwest, seniors may be at especially high risk. Selenium works closely with vitamin E to neutralize oxidative damage inside arteries, preventing the initial injuries that eventually lead to plaque buildup. Many seniors struggling with fatigue, muscle weakness, or irregular heartbeats might not realize that selenium deficiency could be a root cause, and simple supplementation could offer enormous relief. Choosing selenium in the form of selenomethionine, a highly bioavailable form, can ensure maximum absorption, and doses must be kept moderate, as selenium has a narrow therapeutic window, and more is not always better. L-carnitine, specifically. Acetyl L-carnitine and propionyl L-carnitine provides powerful support to the aging heart by improving energy production within the mitochondria, enhancing fat metabolism, and strengthening the heart muscle itself. Seniors in the United States facing congestive heart failure have been shown in clinical trials to significantly improve their exercise tolerance, heart output, and quality of life with L-carnitine supplementation. In Canada and Australia, heart clinics have started incorporating L-carnitine into integrative treatment plans for heart failure patients with promising results. Yet it remains underutilized and often unknown among the general senior population. L-carnitine helps the heart muscle continue beating strongly by transporting fatty acids into the mitochondria, where they can be used for energy, a function that becomes less efficient with age. Seniors who feel exhausted just from minimal activity, who find their world shrinking because of constant fatigue, might benefit dramatically from proper L-carnitine supplementation, restoring not only their heart health, but also their dignity and independence. Many seniors across the United States, the United Kingdom, Canada, and Australia desperately need accurate, actionable information, because making small daily changes can spell the difference between a future filled with vitality and a future trapped by medications, hospital visits, and frailty. It is painful to imagine how many heart attacks, strokes, and heart failure diagnoses could be prevented if these top 10 vitamins and supplements were emphasized more openly by healthcare providers. People trust their doctors in good faith, but the American healthcare system, often driven by pharmaceutical profits rather than prevention, fails to prioritize natural interventions that could genuinely save lives and preserve quality of life. Seniors deserve better than to find out too late that something as simple as taking vitamin K2 daily or correcting a magnesium deficiency could have spared them a lifetime of cardiovascular suffering. Too often in the United States, and even increasingly in the United Kingdom and Canada, heart health is only seriously addressed after the first heart attack, when medications like beta blockers, ACE inhibitors, and statins become lifelong burdens, accompanied by a constant fear of the next event. It is heartbreaking to listen to stories from seniors who recount how they did everything the doctor said, but were never told about vitamins, never told about how their heart needed CoQ10 after being put on statins, never warned about the magnesium they were losing while taking blood pressure pills. Seniors living in Australia, who once felt invincible swimming in the ocean or hiking in the outback, now sit exhausted in their homes, wondering where their energy and strength went, not knowing that correcting nutrient deficiencies might have restored their health and freedom. The emotional toll of living with heart disease is something not enough people talk about. Seniors often feel isolated, fearful, and betrayed by their own bodies. They watch their world shrink, first avoiding long walks, then struggling with stairs, and eventually fearing even simple outings to the grocery store. Watching friends pass away from heart attacks and strokes only deepens the sense of vulnerability. But it doesn't have to be this way. The heart is remarkably resilient when given the right tools, and vitamins are not just side options. They are fundamental, non-negotiable supports for senior heart health. Ignoring them is not just a missed opportunity. It is an outright tragedy that robs people of years of life they could have spent traveling, laughing, playing with grandkids, living fully, not merely surviving. In the United States, healthcare often focuses on crisis management rather than prevention, but seniors still have the power to educate themselves and demand better care, to make their own choices, to support their heart before it reaches the breaking point. Knowing about the power of magnesium to prevent arrhythmias, about the necessity of CoQ10 for energy, about the life-saving potential of vitamin D3 and K2 can transform not only life expectancy, but the quality of every single day lived. In Canada and the United Kingdom, where socialized healthcare sometimes leaves seniors feeling like just another number in the system, personal empowerment through knowledge becomes even more critical. In Australia, where outdoor life is celebrated, but hidden heart risks lurk behind sun-kissed faces. Understanding these vitamins can mean the difference between thriving and just enduring.